The conclusion of the complete physical examination consists of the neurologic examination and the screening musculoskeletal examination. The neurologic examination consists of the mental status exam, cranial nerves, sensory function, motor function, evaluation of reflexes, and cerebellar function. The mental status examination is frequently part of the history. The mental status examination consists of level of consciousness, speech, orientation to person, time, and place, knowledge of current events, judgment, abstraction, vocabulary, emotional responses, memory, calculation ability, object recognition, and praxis, the ability to perform motor action. We're now going to begin the assessment of cranial nerves, and many of the cranial nerves we've already assessed, but those which we've not, we're going to do at this time. Cranial nerve 1, olfaction, is usually never assessed. Cranial nerve 2, we've assessed. Cranial nerve 3, we've assessed. Cranial nerve 4, we've already assessed. But cranial nerve 5, the trigeminal, we have not. There are three components to the trigeminal nerve: the ophthalmic, the maxillary, and the mandibular. So let's assess the sensory function first. Mr. Johnson, I'm going to take this gauze pad and I'm going to touch you someplace on your face with it. I'd like you to close your eyes and tell me, where did I touch you?
The right side of my forehead.
And now?
The left side of my forehead.
Did it feel similar or dissimilar?
It felt the same.
Okay, keep your eyes closed again. I'm going to touch you again on your face. Where did I touch you now?
Left cheek.
And now?
Right cheek.
And how did that feel?
Felt the same.
Okay, and keep your eyes closed. And now?
On my chin, the right side.
And now?
And the left side, my chin.
How did that feel? Similar or dissimilar?
Felt similar.
Okay, you can open your eyes now. We're now going to check the motor function, namely the contraction of the masseter muscles. Can you bite down real hard? And we're checking for symmetry of the masseter. Okay, and you can relax. We're now going to check the corneal reflex, which you'll remember has the afferent limb from 5, the trigeminal, and the efferent limb from 7, the facial. In order to test the corneal reflex, you'll take an applicator stick and pull off a wisp of cotton from the end of the cotton tip and twirl it into a very, very thin wisp, as I'm demonstrating now. Mr. Johnson, what I'd like you to do is just look in the distance, right over here, and I'm going to very quickly touch the cornea, and we're looking for a very rapid blink. So if you just look straight in the distance, and that was a very brisk corneal reflex. We will do the same on the other side. If you just look in the distance, straight, straight. That was a lash reflex. That was not a corneal, but that was a corneal. The 6th cranial nerve we've already evaluated when we were evaluating extraocular muscles, but now we're going to continue with examination of the 7th, the facial nerve. What I'd like you to do is to smile for me. Give me a big smile. Big smile. Great. We're noticing whether or not symmetry is present. We're also noticing the nasolabial folds. Good. Can you frown for me? Okay. Can you wrinkle your forehead? And we're looking for symmetry here as well. Good. Can you puff out your cheeks like this? Good. Don't let me push them in. Good. And relax. And finally, I'd like you to close your eyes real tight and don't let me open them. Fine. Okay, you can open them now. That's the 7th cranial nerve. 8th we've evaluated. The 9th and 10th, glossopharyngeal and vagus, we've evaluated when we had him say ah, and we performed the gag reflex. The 11th, the spinal accessory, we're going to assess right now. Can you push up real tight, real hard? Good. And relax. And can you push against my hand as we evaluate the strength of the sternocleidomastoid and relax? Evaluate the sternocleidomastoid on this side. And relax. And the 12th cranial nerve, the hypoglossal, we evaluated when he stuck out his tongue. So this concludes the evaluation of the cranial nerves. We're now going to continue on with sensory function. The sensory examination consists of taking a gauze pad and having the patient close his eyes as you touch the distal upper extremities and then the distal lower extremities. So Mr. Johnson, just close your eyes for me, please, and tell me, where did I touch you?
My right hand.
Okay. And now?
My left hand.
Okay. Did that feel similar or dissimilar?
It felt similar.
Okay. And keep your eyes closed. Do you feel this?
Yes.
Okay. And do you feel this?
Yes.
Similar or dissimilar?
Similar.
If you determined an abnormality, you would then work your way proximal on the extremity to determine the sensory level. Vibration sense, we're going to do basically the same technique with the distal extremity upper and then lower. Strike the tuning fork and then, very importantly, place your finger under the finger of the patient being examined. If you're able to palpate the vibration, the patient certainly should. Close your eyes, please. And do you feel anything?
I feel a vibration.
Okay. And what about now?
Yeah, I still feel it.
Okay. What about now?
Yeah, I feel it stronger now.
A very useful test to check the reliability of the patient is to strike the tuning fork like this, but then to dampen it by keeping it against your hand, stopping the oscillation, and then attempting to do the test again. And this way you will be able to test the reliability of the patient's response. We'll do this also in the lower extremities. Close your eyes, please. And now, feel that?
Yep.
And do you feel that?
Yeah.
Does that feel similar or dissimilar?
Similar.
Okay, you can open your eyes. The final test for sensory function is to test sharp and dullness with a safety pin. Always dispose of the pin after you've used it to avoid transmission of the hepatitis and AIDS viruses. So I'm just going to open this pin, Mr. Johnson. I'd like you to close your eyes for me. And this is dull, and this is sharp. Okay. What's this?
Dull.
Okay. What's this?
Sharp.
Okay. What's this?
Sharp. Dull.
Okay. Keep your eyes closed. What's this?
Sharp. Dull.
And what's that?
Dull.
And what's this?
Sharp.
Okay. Keep your eyes closed. This is sharp. And this is dull.
Okay.
Okay. What's this?
Dull. Sharp.
Okay. And this is sharp. And this is dull. What's this?
Dull.
Okay. And this?
Dull.
And this?
Sharp.
Okay. Does it feel about the same?
Yep.
Okay. And we're going to dispose of the pin. We're now going to assess position sense. Mr. Johnson, would you close your eyes for me? I'm going to hold the distal digit of the finger and the sides of the finger and tell me, this is up, this is down. What's this?
Up.
Okay. And this is up, this is down. What's this?
Down.
We would then repeat the same procedure on the other hand and the lower extremities. We've just completed our assessment of sensory function, and now we're going to go on to our assessment of reflexes. There are 3 reflexes in the upper extremity and 2 in the lower. The first in the upper extremity is the biceps tendon reflex. What one does is to support the patient's arm and to place your thumb on the biceps tendon. You then take your reflex hammer and briskly strike the tip of your thumbnail. The response that we're looking for is a rapid contraction of the biceps muscle. The second reflex is the triceps reflex. We can support the arm, and in this example, we strike the triceps tendon directly, avoiding the ulnar nerve. The response we're looking for here is a rapid contraction of the triceps muscle. The third reflex in the upper extremity is the brachioradialis reflex. The arm is placed in this position, and the brachioradialis tendon is struck here, and the response we're looking for is supination of the hand. All three of these reflexes are then repeated on the other side. Now we're going to go down to the reflexes of the lower extremity. The patellar reflex is evaluated by placing your hand on the person's thigh, and close your eyes please, Mr. Johnson, and striking the tendon briskly. One more time. We would repeat this on the other side as well. We're now going to do the Achilles reflex. One method of assessing the Achilles reflex is to flex the hip, knee, and ankle, as I'm doing now, and to briskly strike the Achilles tendon. The response we're looking for is plantar flexion of the foot. While we're in this area, we can also attempt to elicit a Babinski reflex. Remember that a Babinski reflex is an abnormal reflex. We place the tip of an applicator stick at the heel of the foot and bring it on the lateral margin, coming to the base of the toes, running to the base of the large toe, as shown. The normal response is plantar flexion. The abnormal response is dorsiflexion and a fanning of the toes. This response, an abnormal reflex, is seen in pyramidal tract diseases. And this concludes our assessment of reflexes. We're now going to continue with the assessment of motor function. We're now going to assess motor function and a screening musculoskeletal examination in the upper extremities. Mr. Johnson, I'd like you to trap my hand, bring your chin down, and press and relax. And do it back here. Press and relax. Trap my hand over here and relax. Trap here and relax. Push forward and relax. Push back and relax. You bring your arms up like this and push and relax and push down and relax. Make a fist for me. Don't let me open them. And relax. And don't let me push your wrists in. And relax. Good. You can put your arms down here. We're now going to assess motor function in the lower extremities. Push up and relax and push down and relax. Push forward, relax, push back, relax, push up, relax, and push down and relax. One test for cerebellar function is the finger-to-nose test. I'm going to place my finger here, and if you raise your right finger and touch my finger and touch your nose. Touch my finger, touch your nose. Touch my finger, touch your nose, close your eyes, touch my finger, touch your nose, touch my finger, touch your nose. And you can open your eyes. An important assessment of cerebellar function is the Romberg test. Would you put your feet together for me? And just bring your arms up like this and close your eyes, and I'm going to let your hands go. And just stand like this with your fingers open. Fine. You can open your eyes, put your arms down. We're now going to assess gait. The final part of the neurologic examination is assessment of gait. Would you walk toward me? And stop right there and turn around and walk on your toes. And turn around and walk on your heels to me. And we stop right there and turn around one foot in front of the other. Tandem walking, like you're walking a straight line. Fine. And you can stop right there. And this concludes the complete examination of the man. We're now going to continue with examination of the female breast and the pelvic examination.